Hmm. Hello, it's me, Dr. Sinha, from the Department of Biochemistry. I am working as Assistant Professor in Santosh Medical College. So today I am going to discuss about the vitamins. So first of all, you should know what are the classes of, or how will you classify vitamins. So it can be classified into two forms, water-soluble vitamins and fat-soluble vitamins. So you can understand from the name itself, water-soluble vitamins are the vitamins which are soluble in water. As they are soluble in water, they are easily excreted through kidney. After all, you should know what are the examples of water soluble. So in water soluble vitamins, it is vitamin B and vitamin C. And vitamin B is B complex because there is no single vitamin in B complex. It is like vitamin B1, B2, B3, B4, B5 like that. So we will discuss vitamins accordingly. So now coming to how would you define vitamins. As you know, we have in food, in nutrition, we have divided foods into macronutrients and the micronutrients. Macronutrients are the things that comes under the carbohydrate, lipids and protein. These all things make the macronutrient, and the micronutrients are the nutrients like vitamins and minerals. So how will you define vitamins? So small organic molecules which is present in diet and it is required in the small amount. So that can be vitamins and minerals. So we are classifying with vitamins now. So why vitamins are important? So they are important to maintain our normal body function, and most of the vitamins are also working as the precursor or provitamins. For example, beta carotene is the provitamin form of carotene. Now, as I have said, we have divided into fat-soluble vitamins and water-soluble. So A, D, E, K, these are the fat-soluble vitamins which require fat for its absorption. So if there is any problem regarding to fat solubility like malabsorption or after any particular surgical operation, anything, it will affect the absorption of fat, though the vitamin A, D, E, K, these are solubles in fat. So if there is problem in solubility, anything related to fat, it will definitely affect the absorption of vitamin A, D, E, K. Why so? Suppose some patient is coming to you and he is like chronically deficient in vitamin A or D, say whatever vitamins. So you are treating, you are supplementing that person, but there is no deficiency of D as such, but there is problem in absorption. So you should always see the causes when you are supplementing some patient with the vitamin A or D or E or K, whatever. You should see, is there any history of fat malabsorption or is there or not. Now, what is the property of fat soluble? As they are they are soluble in fat, they are not excreted through urine, so they have tendency to get stored in our body organ. And after a certain period, after a certain level, when it is stored in much more amount that is required, it gets deposited and cause toxicity. So same water-soluble vitamins, they are not stored in our body, so they are easily excreted to kidney, so they are less toxic. They are not toxic, but one exception is always there, that is vitamin B12, that is water-soluble, still it gets stored in the liver, and after excess of amount, it can also cause toxicity. So vitamin B12 is that water-soluble vitamin which is an exception, which is getting stored in our liver. So now what is the biological importance? Why we are studying vitamins? So vitamins are essential for our growth, maintenance and reproduction, and they are also used for some vitamins used for energy, not directly but like as a coenzyme and cofactor. For example, fat soluble vitamins are required for mainly three things. You can remember, like normal vision, then blood clotting, bone formation, and maintenance of memory structure. Vitamin A and D, they work as a steroid hormone also. So, and most of the water-soluble vitamins, they are functioning as coenzymes and prosthetic group of several enzymes which are involved for the metabolism of carbohydrate, lipids and amino acid. So deficiency of any kind of vitamins will lead to the deficiency according, like for example, if you are suffering from vitamin D deficiency, it will lead to night blindness. If there is a deficiency of vitamin D, it will lead to skeletal deformities. And vitamin A, K and E, they are responsible for maintaining the normal hemorrhage and hemolysis state. So we will discuss later in the coming slides. So starting from the first we will be discussing the importance of few more indication of these vitamins. Again, if we are talking about the vitamin like B complex and all, there are so many things like anemia, beriberi, pellagra, etc. Then vitamins analog are used also as a drugs. For example, you can take the example of folic acid. One anti-cancer drug that is called methotrexate. In that we use folic acid analog. At ISO, for example, like vitamin D, they are, I told you they are very toxic. So the moderate amount of vitamin which are fat soluble are needed. So we should keep on checking whether we are taking in the normal amount or not. Excessive of anything is too bad for our health. So now coming to the consumption of vitamin C. So as you know, vitamin C is very potent antioxidant. Antioxidants, what are antioxidants? You know, as we grow, there are the accumulation of free radicals, that is free oxygen species. They get accumulated in our body, and according to our age, as we go aging, it increases. The amount of free radicals are increasing day by day. So we need a balance to maintain all that. So antioxidants play an important role. In antioxidants also you can divide them into two parts, like one is the vitamin base and other is the enzymes. So if we are talking about the vitamins C, beta carotene, then vitamin E, these are very potent antioxidants. Vitamin B12 and vitamin B6, they are very essential for maintaining coronary artery disease patient to maintain their levels of homocysteine, because you know homocysteine has got deteriorating effect on CVS. If there is an increased level of homocysteine, it will lead to the cardiac damage, the coronary artery disease, and vitamin B12 and folic acid plays an important role in keeping check on the levels of homocysteine. Now coming to the vitamin B complex. So what are the vitamins? So first is the vitamin B1, that is called thiamine. Vitamin B2, that is called riboflavin. Then coming to vitamin B3, that is niacin. Then B5, pantothenic acid. B6 is pyridoxine. B7 is biotin. B9 is folic acid. And the last one, vitamin B12, is cyanocobalamin. So what is thiamine? Thiamine is the first vitamin B complex member. So thiamine is the first one. So you know, vitamins, we can divide the water soluble vitamins in two parts. Like one is the homeopathic types and the other is energy giving. Like energy, indirectly they are participating in energy giving process. So if we are talking about the homeopathic, like vitamin B6, vitamin B9 and B12, that means cyanocobalamin, folic acid and pyridoxine. These three are very homeopathic because they help in formation of blood cells. Now the other group is energy giving. The rest of the vitamins are required for energy giving. So when we are talking about the vitamin A, vitamins like water soluble vitamins, so they need to be activated before they work. For example, if we are talking, let's say thiamine, this is thiamine, vitamin B1. So the thiamine pyrophosphate, that is the active form of thiamine. So why do we need active form? To do any process, like it is formed from the thiamine in the presence of ATP in a reaction catalyzed by thiamine kinase that is present in the liver. So TPP, which is called thiamine pyrophosphate, it is a prosthetic group of enzymes like pyruvate dehydrogenase and alpha ketoglutarate dehydrogenase. What are the sources? All the sources like outer coating the food, especially the rice bran, the outer layer of the rice, that is very good source of vitamin B1 thiamine. So most of the people in the urban cities, we are having polished rice, that is not good for health. Then other sources are like whole cereals, pulses, oil, seeds and nuts, and meat, liver, egg and fish. These are other sources. So what happens if there is a deficiency of thiamine? So it can be three types. One is the wet type, dry type and the infantile type. What is infantile type? Infantile type very that occurs because of mother. Either it can be during the time of pregnancy or after birth during the lactation period. If the mother is deficient in any of these phases, maybe in pregnancy also or lactating also, so it will definitely affect the infant, the newborn baby. So what will happen? The child will become very irritable, he will feel always irritated, crying, cranky kind of thing. Now coming to the adult beriberi, it can be divided into two parts, that dry one and the wet one. So what do you mean by the wet one? Wet means edema. It is like edema. You know, when the cardiovascular system, when the cardiac failure is there is accumulation of water. This is called edema. So what is edema? Basically the accumulation of fluid. This is called edema. So when there is congestive heart failure, there is tendency of getting accumulation of this fluid. This is called edema. So when, because there is deficiency of thiamine, the beriberi, when the CVS is involved, it is called wet beriberi. That is because of edema. Apart from this, what is dry beriberi? Dry beriberi, there will be the neurological symptoms. So most commonly it is seen in the patient of two kinds of patient. One is this one, like alcoholic. It is very common in alcoholic people. Why? If they are like, if there is history of 15 to 20 years of alcoholism, it is highly seen. This kind of beriberi seen. What happens? What is the reason of this deficiency? The first reason is that usually the alcoholic patients, they are like they don't take meal properly. They want to skip every time. So this is the first reason, like they are skipping their meals for alcohol intake. Second, alcohol has also got the malabsorption symptom. Whatever we are taking, in spite of this B1, B2, anything with whatever we are taking, alcohol interferes with the absorption of. So there are two reasons why there is deficiency of vitamin B1 in alcoholic patient. First is that alcoholic patients are skipping their meals, so there is deficiency. Number one. Number two, if you are getting also, if they are having this food even 3 meals also, but there is difficulty in absorption due to alcohol, because alcohol interferes with the food absorption. Apart from this, if the patient is not alcoholic, normal person, what happens if we are in habit of taking polished rice without the bran? It is on prolonged phase after 10-20 years, there can be chance of beriberi if it is not like supplemented with the other source. So this was the type of beriberi: wet beriberi, dry beriberi, and infantile beriberi. So now coming to the vitamin B2, that is riboflavin, and what happens? Riboflavinosis, the disease which occurs due to deficiency of vitamin B2. As I told you, TP was the first active form of vitamin B1, that is thiamine. Again we have the form of active form in this also, that is FMN and FAD. So what are the sources? Same like whole grains, legumes, pulses. These are the various sources of vitamin B2. What happens if there is deficiency of vitamin B2? So it will lead to the following things like angular stomatitis, cheilosis, then corneal vascularization and glossitis. So what happens in this? So what is glossitis? Glossal term means tongue. So there is inflammation leading to magenta color of tongue. It is called glossitis. What is cheilosis? It is associated with the cracked lips. When you got cracked lips, this is called cheilosis. Then angular stomatitis. So this is the angle of mouth. You can see this is the angle of mouth. So what happens if there is deficiency of riboflavin? You will see the fissure, the bleeding part over there. This is called angular stomatitis. Then in cornea and conjunctiva, you will see the neovascularization, the clotting kind of things. So all these things are happening because of vitamin B2 deficiency. Now coming to the niacin, this is very important for practical purpose and for your spotters also, and even for your cases also. So what is niacin? Niacin is the third vitamin B complex, that is B3, and you should know the active form again, that nicotinic acid and nicotinamide, these are the things. And nicotinamide is the component of two coenzymes, NAD and NADP. So what are the sources? The whole grain, peanuts, legumes, yeast, liver, fish, meat, milk and egg. Now milk and egg are not that much good source of, but still they are source, and vegetable and fruits are also definitely poor source of niacin. So niacin deficiency, what will be the disease caused due to niacin? So it is called as pellagra. Usually it was 3 Ds like dermatitis, dementia and diarrhea. So what do you mean by dermatitis? Just irritation of skin is called dermatitis, and flaky skin, dermatitis, itching and all. Then diarrhea, you know, and if there is blood in diarrhea, it is called dysentery. And the third one is dementia. What is dementia? The ability of like you can't remember the things, you tend to forget everything. That is called dementia. So 3 things: dermatitis, diarrhea and dementia. So now if they are not treated, what happens? If you are not treating dermatitis, diarrhea and dementia, it will lead to death. So now there are 4 Ds of pellagra. So what is the reason? Is the niacin the only thing that is responsible for having this pellagra? No. There are 3 vitamins which are important for developing niacin in their deficiency. First one, this the niacin, the topic which I am discussing right now. Then apart from this, tryptophan and vitamin B6, that is pyridoxine. So I'll discuss how. Because tryptophan is a precursor for niacin, that means you get niacin from tryptophan. What happens, for example, 60 mg of tryptophan will give rise to 1 mg of niacin. So I told you, because of deficiency of niacin, there is this is called pellagra. So if niacin is not there, it's fine, it will lead to pellagra. But if there is no tryptophan also, so what happens? In the deficiency of tryptophan, you won't get niacin by the conversion of tryptophan to niacin. So in that case also you will get pellagra. So two reasons, tryptophan and niacin. And the third one is vitamin B6. Why? Because when there is conversion of tryptophan to niacin, their vitamin B6 is required for that. So in any of three, vitamin B6, tryptophan or niacin, there is deficiency, it will lead to pellagra. So coming to the fifth vitamin, that is pantothenic acid, the main symptom is like burning hand foot syndrome. This is the most common because of vitamin B5 pantothenic acid. So what do we call vitamin B6? That is pyridoxine. As I told, vitamin B6, what are the importance? So two to three things are important in vitamin B6. First, it is called as pyridoxine. Then what happens? It is associated with heme synthesis. The first step of ANA synthesis, that is dependent upon this vitamin B6. So if there is no B6, it will lead to the deficiency of that proper heme synthesis. So it is responsible for anemia. Number one. Number two, in few patients, the patients are on the anti-tubercle drug. There are a few anti-tubercle drugs like rifampicin, isoniazid. There are so many side effects. Almost all the drugs of TB, they have got a side effect, whatever may be the pyrazine. So we will talk about the isoniazid. So isoniazid has the side effect of what? Peripheral neuropathy. So what is the reason behind this? Because the patients who are on anti-tubercle drugs, one of the drug is isoniazid. So isoniazid, what it does, it just interferes with the vitamin B6. The absorption of vitamin B6 is reduced. So in the patient who are on the anti-tubercle drug, they will have this peripheral neuropathy due to deficiency of vitamin B6. So we have to supplement the person with the vitamin B6. Now the pyridoxine phosphate is its active form. It is formed from the pyridoxine by the phosphorylation catalyzed by pyridoxine kinase. As you know, whenever the phosphate is added, the kinase comes into play. So what are the sources? The whole grains, legumes, liver, yeast, these are the things that are responsible, that are good sources of what? Vitamin B6. Then pyridoxine phosphate acts as the prosthetic group for enzymes which are involved in transamination. So what do you mean by transamination? Transfer amino groups to keto group, like decarboxylation and desulfuration. In all these reactions, pyridoxine phosphate acts as the prosthetic group. It is also a coenzyme for synthesis of heme, serotonin, catecholamines. Catecholamines are epinephrine, norepinephrine that are synthesized for adrenal gland. Now the second last is the folic acid and last is the vitamin B12. So two things common about these vitamins are, they are required for the DNA maturation of RBC. When RBC, when it is immature, it has got bigger size. If we display between the red blood cells, like immature versus mature, the immature is bigger one, and after when it becomes mature, the size becomes smaller. And the immature RBC are also nucleated, whereas the mature RBC are without nucleus, that is called anucleated. So what happens? Folic acid, that is vitamin B9 and B12, these two vitamins, these are required for the DNA synthesis, DNA maturation of the RBC. So if there is deficiency, it will lead to the faulty reaction. The maturation of RBC would not be attained. So what will happen? The RBC will be bigger inside, because in maturity it becomes smaller. There is no maturation, though it keeps on, like the bigger size will be there. So it is called macrocytosis or megaloblastic anemia. Methyl tetrahydrofolate, it is the major sulfuric form that is bound to protein, and the tetrahydrofolate, which is reduced from folic acid, is carrier of one carbon atoms. Now, what are the green sources? Green leafy vegetable like cabbage, ladyfinger, curry, and these are the most common sources of this folic acid. Then, what happens during folic acid deficiency? Two deficiency. One, megaloblastic anemia due to immature RBC, and the second one is in pregnant female, if they are deficient in folic acid, it will lead to the neural defects of the child. So nowadays, before planning also, if a couple is planning to have babies, what happens before 3 months, they are supplemented with, the female is the pregnant woman who is planning, like the girl who is getting pregnant, like she starts taking this folic acid, in fact 3 months prior to having conceived. So last is the vitamin B12. So it is cyanoconvulsant. Again, it has got the property of this DNA maturation. So in the deficiency, there is chances of megaloblastic anemia. So for megaloblastic anemia, there are two causes: vitamin B9 and vitamin B12. These two things are important. These two can cause the megaloblastic anemia or macrocytosis, because the cell is macro means big and cytosis means cell, the bigger size of cell. Vitamin B12 acts as phosphatic group or coenzyme also, and the absorption of vitamin B12 takes place in ileum. Now, one vitamin that pathogenic I have discussed, the burning food syndrome is important for that. Then biotin. What was biotin? It was B7, you know, because of like hair follicles and everything like nowadays you are seeing the cases of falling of hair. That is because of the biotin. Biotin is very important to maintain our good hair. Now, what happens? Now we will discuss few things about the fat soluble before completing this. Yeah, vitamin C also important, like we have discussed the vitamin B, now vitamin C. This, the second name is ascorbic acid, that is heat labile. That means when we will heat this vitamin C, it will be labile and will destroy. So, vitamin C is ascorbic acid. What is the function? Ascorbic acid as an antioxidant. You know, vitamin C is very good antioxidant. It is important for formation of collagen because it is involved in the hydroxylation reaction. Then the catecholamides synthesis for tyrosine. You know, from tyrosine we get epinephrine and norepinephrine. So vitamin C is important in producing of these things. And the liver and bile acid synthesis also require vitamin C. It is very useful for absorption of iron. Why? Because you know, in hemoglobin there is hemoglobin part is there, and the iron is there in the ferrous form. That is the most required form. That is the normal form of iron in hemoglobin. So vitamin C helps in to keep the iron in ferrous state. Then the various catabolism of tyrosine is also dependent upon the ascorbic acid. Then it helps in controlling the bacterial invasion. That's why when immunity is decreased, we are advised to take vitamin C. Why? Because it acts it inhibits activity of bacterial hydrolysis enzyme. So what happens? The disease caused due to vitamin C deficiency, scurvy. What happens to scurvy? It causes hemorrhage in various tissue. Then general weakness and anemia, swollen joints, swollen gums, loose tooth. Then susceptible infection, as it protects us for immunity, so deficiency is going to bring us the infection. Then delayed wound healing. Then bone will be fragile and osteoporotic. So the name is called scurvy. Most of the things in the infant when they are weaned off. So what is the meaning of weaning? It is like according to WHO, you know that mother is asked to exclusive breastfeed for 6 months. After 6 months, when you are introducing some new food apart from the breast milk, that is called weaning. So if you are not properly giving the vitamin C in the introduced product, the recent apart from this breastfeed milk. So what happens? There is chances of developing scurvy in that. So what are all the like citrus food like guava, coriander, amaranthus leaves and vegetable, then guava, then lemon, lime, kiwi, these all are the tangy food. All these are the rich source of vitamin C. Even grapes and apple are also some source. So what are the fat soluble? That is A, D, E, K. So first is the vitamin A. So what are the forms? Retinol, retinal and retinoic acid. What happens in our body? There are 3 forms: retinol, retinal and retinoic acid. The retinol gets converted into retinal and retinal to retinoic acid. So conversion of retinol to retinal is interchangeable, is reversible, like from retinol to retinal and from retinal to retinal. But once the retinal is getting converted into retinoic acid, it is irreversible. So what are the various functions? So you know, for eye, the retinal foil is important. Retinal is is responsible for vision. And what form? The cis form. There are two forms, cis form and trans form. The cis form is like the bent form. So it is the main thing that is responsible for eye or vision. So what are the functions of vitamin A? So the three major retinoids, retinol, retinol and retinoic acid have unique functions. The retinol is required for the normal and color vision. Retinol is required for reproduction and growth. Retinol is required for differentiation and function as steroid hormone, synthesis of glycoprotein, mucopolysaccharides. Retinoic acid acts as a steroid hormone. It promotes growth and differentiation, and retinol and retinoic acid are involved in regulation of gene expression, because it, like from mRNA, you know, replication, transcription, translation, matlab formation of one DNA. In replication you get DNA from DNA, then in transcription you get messenger RNA from DNA, and mRNA to protein is translation. So what happens? There are three sensitive pigments. The primary colors are red, green and blue. These are the colors because of porphyrosin, iodopsin and synopsin. These are pigments because of this. Any problem in this pigmentation will lead to color blindness. So what happens? The signs of deficiency of vitamin A is night blindness. Night blindness. What will happen? In the early stages, the affected individual is not able to see clearly in dim light or night light due to block in the resynthesis of rhodopsin. In later stage, what will happen? The affected individual cannot see or read in dim light. Thus, the loss of night vision, that is called night blindness, the major initial symptoms. So that nowadays we are fortifying everything vitamin A. In school also, there are various programs that are supplementing vitamin A. Growth of bone formation and tooth are also defective in the absence of vitamin A. It will affect the nerve growth also, because you know myelin sheath is there, that which causes conduction of nerve impulse. So there is deficiency, degeneration of myelin sheath because of deficiency of vitamin A. Then the skin will become very hard and tough, because this is all toad skin kind of thing. Then reproductive disorder, like testicular degeneration, then fetal malabsorption and some changes in kidney also. So what are the sources? The marine fish oils like halibut, cod liver oil, shark liver oil, they are the excellent source of vitamin A. In plants, oil like red palm oil is also very good. Leafy vegetables are the sources of vitamin A, and all the fruits, all the plants that are yellow in color because of that pigment, beta carotene pigment. They are like you can say papaya, mango, pumpkin. All these are the richest source of vitamin A. Now coming to vitamin D, it is also called sunshine because you know the vitamin D is synthesized in the skin. After that it comes to liver and then to kidney. So it is very important for metabolism of calcium and phosphate also. So the major action of calcitriol is to increase the absorption of calcium and phosphate in the intestine, particularly in duodenum. Calcitriol is required for bone formation and mineralization of bone so that it becomes strong and tough. Calcitriol affects the calcium and phosphorus excretion, so it affects the it maintains the level of calcium and phosphorus also. It gives the proper muscle tone, and it plays a vital role in controlling immunity because it affects the monocytic macrophage activation. Now what happens? If there is deficiency of vitamin D, it will lead to rickets in children, osteomalacia in adult and osteoporosis in female after menopause. Rickets, the person, the baby, the children, what will it show? They will show the classical sign of soft bones, deformity skull, then you will see the prominent ribs and the bow leg. What happens in osteomalacia? There is skeletal pain, back pain, difficulty in walking, pelvic pain is there, and in osteoporosis, you know, this happens with the advancing age, mostly after the menopause. So what are the important sources? Like marine fish again, like the vitamin A, halibut oil, cod liver oil, these are the sources. And there is toxicity also. If you will take excessive of vitamin D, it will lead to toxicity. So what are the features of toxicity of vitamin D? There will be symptoms of nausea, thirsty feeling, vomiting, polyuria, calcification of lungs and kidney leading to the renal stone. Now coming to the vitamin E. So what do you mean by vitamin E? It is tocopherol. So tocopherol is very important for reproduction, maintenance of reproduction and healthy skin. What is the function of tocopherol? The tocopherol, the alpha tocopherol, is very important in cell membrane and cytosol, and it works as an antioxidant. It is present in high concentration of tissue which are exposed to high O2 pressure, like high oxygen, like the area of lung, you know, the apical area of lung, there is flow of oxygen is very high. Then erythrocytes, means red blood cells, and the retina. It acts as a chain breaking antioxidant. It is important for maintaining muscle tone also. Then it helps in the synthesis of hemoproteins. Then it also prevents the deleted vitamin A. What are the sources? Like wheat germ oil, corn germ oil, whatever the like seeds, the oil inside that is source for vitamin A. Now coming to the vitamin K, the last vitamin K, the fat solubilized vitamin K, and you will call it quinone. So you should know that at least two form vitamin K1 and K2. So what is K1? This is the source of vitamin K that you will get it from plant. That is called phytoquinone. It is the major form of vitamin found in plant and green leafy vegetable. K2 is minaquinone. What happens? It is present in animals and synthesized by intestinal flora. So what is the absorption site? Vitamin K of DHT are easily absorbed in small intestine in presence of bile salt. What are the sources? Cauliflower, cabbage, spinach, turnip, green peas and soya bean. These are the richest source of vitamin K. So what is the function? You know, in vitamin K, there are few factors, clotting factors like factor 2, 7, 9, 10. These are dependent upon the vitamin K. And vitamin K is synthesized in liver. So when there is deficiency of anything which will lead to the deficiency of vitamin K, the factors which are dependent like vitamin 2, 7, 9, 10, there is deficiency of those factors also. This will lead to the, if there is deficient clotting factor, it will lead to bleeding. So first one thing is this one. Then it is required for the carboxylation of gamma carbon atom of glutamine residues for factors. So it is helpful in the gamma carboxylation also. So what will happen? What is the deficiency sign? So in newborn child there will be bleeding, like uncontrolled bleeding to nose and GIT. That bleeding from nose is called epistaxis. Bleeding from this area, epistaxis. The GI bleeding is there. You can see in the blood in stick in the stool also. And how will you treat? You will give the injection intramuscular vitamin K iron. Then what happens in the adult? Because hemorrhage is not that much common. The main problem appears when the patient is on like antibiotics, like chronic antibiotics, like 15-20 days for a period of weeks, like that. In that case, the antibiotics will alter our intestinal flora. The common flora that is required for producing vitamin will be affected, and there will be deficiency of vitamin K. So these are all things about the vitamins. Like initially I'll discuss, I'll tell you the water soluble. Vitamins can be divided into water soluble, fat soluble. Water soluble are vitamin B and vitamin C. Vitamin B is like complex, not a single vitamin. Then in fat soluble is A, D, E, K. You can remember like Kira also, K, E, D, A, D, E, K. Got it? Then in water soluble you can divide again further into classification like homeopathic one and the vitamins that are giving energy indirectly, like working as a coenzyme and cofactor. So I hope this lecture is clear to you. So I have covered the topic vitamins, water soluble and fat soluble. Thank you. Okay.